Welcome to day 22 of Acharya Red Connect 2025, a premium online webinar series organized by Department of Medical Imaging Technology, Acharya Institute of Allied Health Sciences, in association with Indian College of Radiological Technology. I, Muriel, lecturer in Department of MIT, will be your host for today. Thank you all for joining us. Before we dive into the session, let me take this opportunity to introduce you all to our esteemed speaker for today, Ms. Amita Dabholkar, an assistant professor at the esteemed Dr. D.Y. Patil School of Allied Health Sciences, Dr. D.Y. Patil Vidyapeeth, Pune, deemed to be University, Maharashtra. Ma'am has over 4 years of experience in teaching both undergraduate and postgraduate students. Ma'am is currently pursuing her PhD at the same institution, expanding her expertise in the field. Her academic contributions go beyond teaching as she has published multiple research papers in renowned Web of Science and Scopus Index journals, reflecting her deep commitment to advancing knowledge in her field. Additionally, Ma'am has actively shared her insights as a resource person, delivering lectures on cutting-edge topics such as AI-driven motion correction in MRI and CT imaging workflows. We are truly fortunate to have you with us today, ma'am, and we welcome you warmly. Over to you, ma'am.
So good morning, all of you. I'm Ms. Amita Digambar Dabholkar, Assistant Professor from Dr. D.Y. Patil School of Allied Health Sciences. As Middle Ma'am have already given the introduction about me. So we'll start on the session. So I'm here to deliver a talk on quantitative susceptibility mapping, its principles, advancements, and clinical applications. So moving on to the introduction. So introduction to quantitative susceptibility mapping. So this quantitative susceptibility mapping, it is an advanced MRI technique that will basically quantify the tissue magnetic susceptibility. Okay. So how this quantification is done? So this quantification of the tissue magnetic susceptibility is done by with the use of the phase shift in MRI. Okay, so we are using here phase shift from the MRI. So traditionally, before actually we were using the we are getting the qualitative images. Okay, in conventional MRI, we are getting the qualitative images rather than quantitative. So here we are focusing on the quantitative maps. Okay, so this QSM, it provides the measurement of iron, calcium, and myelin distributions within the tissues. So this quantitative susceptibility mapping, okay, it can be applied in various applications such as like a neurology, cardiology, and oncology purposes. So these uh, basically this technique, this QSM, the advanced MRI technique, it is basically a non-invasive technique, and this will provide the quantitative tissue characterization, which makes this technique as a valuable tool in modern medical imaging. Moving on to the magnetic susceptibility in tissues. So what do you mean by magnetic susceptibility? It is nothing but when any material is placed in a external magnetic field, what will happen? It will be magnetized, right? So when you are placing any material, you will see how it reacts to the external magnetic field. So that is called as the magnetic susceptibility. So this magnetic susceptibility, it is classified into two, that is paramagnetic materials and diamagnetic materials. So these paramagnetic materials are iron, deoxyhemoglobin. So these materials, they will have the positive susceptibility. So these positive susceptibility materials, they will be clearly visible on QSM images. So I'll be seeing for quantitative susceptibility mapping as QSM. Okay. So these positive susceptibility materials, they will be clearly visible onto the QSM images. Okay, so this it will have that the external magnetic field here it will be increased. Okay, in paramagnetic materials, the external magnetic field will be increased and it will be clearly visible. So these paramagnetic materials can be able to visualize in certain conditions like in ion accumulation, in certain diseases like neurodegenerative diseases, hemorrhages. Okay, then we have something called as diamagnetic material. So these diamagnetic material like myelin and calcium. So these materials, they are having a negative susceptibility. So these materials, the myelin and the calcium, which is having a negative susceptibility, they will decrease the external magnetic field. Wherein in paramagnetic materials, there we have an increased magnetic field, external magnetic field, wherein in diamagnetic they will it will the magnetic field will be decreased or it will weak. Okay, so uh, these materials, okay, the diamagnetic materials, it will weak this local field. Then the myelin and the calcium, which is having a negative susceptibility, so this can be we can use this to see so many diseases like myelin damage we can see in multiple sclerosis, and also the calcium deposits can we can also see in stroke patients. So here this QSM's ability, okay, this quantitative susceptibility mapping, it is having a ability to differentiate between these materials, okay, these both materials, paramagnetic as well as the diamagnetic materials, okay. So that will be useful for different disease diagnosis, different types of disease diagnosis like the neurodegenerative diseases or the cardiac diseases, and we can progress its monitoring or we can check the treatment planning. Okay, this is the thing about the magnetic susceptibility. Moving on to the historical development of QSM. So early in the early MRIs, what we were doing is we can detect this phase imaging. Okay, so in the early MRIs, we were using the phase imaging, and also we can detect this magnetic field variation, but but the quantification was not possible here. Okay, the quantification of the images was not possible here. We were we were having the phase imaging, but quantification was not possible. Basically, the phase contrast in MRI, it was visible, but it cannot be interpretable in early MRIs. So during the 2010s, what happened? There was an advancement in computational algorithm like that is called as MEDI. Okay, so it's like morphology enabled dipole inversion. Okay, so there was a advancement in this computational algorithm, so that allowed this accurate mapping of tissue susceptibility. Okay, so we got this into the 2010 by the use of this algorithm, the which is called as the MEDI. So that provided the accurate mapping of tissue susceptibility. So now today we are using this QSM. It is widely used, mostly used in clinical and research imagings. So this technique helps to uh, diagnose the different types of diseases like neurodegenerative diseases. Then they can assess the hemorrhage, and also can iron. Also, it can evaluate these iron and calcium deposits. Okay, this is about the historical development, how these QSM came into use. Moving on to the workflow of QSM. So here basically there are four steps. So this workflow is having a four steps or its basic principle. So first step is the phase data acquisition. Then we have a phase unwrapping. Then the next step is the background field removal. And the fourth and the last step is the susceptibility inversion. So we'll see these steps in detail. So moving on to the phase data acquisition. So in phased data acquisition, which is the first step into the workflow of this QSM. So under this, how we are acquiring the phase data or in the for the QSM imaging. So here we are using the gradient echo sequences in MRI. So these gradient echo sequences, what it will do, it will capture the MRI phase data. Okay, it will capture the MRI phase data or the phase shift. Okay, which is caused due to the different, which can cause due to the tissue susceptibility differences. Okay, so those phase shift it will capture. Then we can also use these multi-echo gradient sequences. Mostly, we have to will increase will use these multi-echo gradient sequences because it improves the accuracy. Okay, so how it improves the accuracy? Like this sequence, what it will do? It will acquire the multiple images. Okay, it will acquire the multiple images at different time points, so there is a short duration, right? So in this sequence the multiple images will be acquired at different time points, so it will reduce the noise and overall it will increase the signal to noise ratio. Okay, basically we are acquiring this multiple images, thereby it will reduce the noise and increases the signal to noise ratio. So here we have a longer echo times. So longer echo times, time to echo, alternative term, time to echo. Okay, so time to echo is T is long here. So it increases the sensitivity. Okay, it increases the sensitivity here. So which sensitivity is increased? So sensitivity to susceptibility effects are increased here. So if the sensitivity is increasing here, so obviously it will introduce some motion artifacts because the time to echo is long. Okay. So here the motion artifacts may be introduced. So this, if if the artifacts are arising, then obviously it will require the optimization, right? So when we are acquiring this phase data, we should choose this echo time and the parameters, the acquisition parameters properly because it can directly influence the quality of the QSM images. So we should select these sequences and the acquisition parameters properly because it overall it affects the quality of the QSM images. Okay. Moving on to the phase unwrapping. So in under phase unwrapping, actually here the MRI phase images when you are acquiring, those images are inherently wrapped. Okay, first of all, when you are acquiring, it is already wrapped images. Okay, like means the phase values which are present. Okay, the phase values it will be limited or it is constrained that can cause the artificial discontinuities in the images. So because of this issue, okay, because of this issue, the wrapping issue, it may be difficult. Okay, it may be difficult to interpret this susceptibility variation in tissues properly or accurately. Okay, because of these wrapping issues, it is very difficult to interpret the susceptibility variations. So here the phase unwrapping step is followed. So how this phase unwrapping is done? Here we are following the mathematical process. Basically, we are reconstructing the image. Okay, we are reconstructing the true phase shift distribution. Okay, the true proper correct phase, whatever is present into the phase shift or the phase images, we are reconstructing that. So there are two methods to do this phase unwrapping. First is called as Laplacian based unwrapping and second is region growing techniques. In uh, Laplacian based unwrapping, uh, like uh, first what we are getting is artificial discontinuities, right? So in this method, that artificial discontinuities, it will be smoothed out. Okay, so it will be removed. And in second, that is region growing techniques, it will iteratively, it will recovers the correct phase values. Okay, so the whatever the correct phase values are there, it will be recovered. Okay, so there are two methods, that is Laplacian based on wrapping, and second is region growing techniques. So this phase unwrapping step, it should be followed properly. So accurate phase unwrapping, it is essential. Okay, it is essential for subsequent processing QSM processing steps. Okay, to process this QSM, we have to follow this step, and it should be accurate. This phase unwrapping step. So if any error, okay, if we are getting any error at this stage, okay, it may lead to some artifacts which can reflect into the final susceptibility maps. Okay, so whatever the artifact, if we are getting, if we are not following this step properly, we can get the artifacts into the final susceptibility maps. So without this phase unwrapping step, okay, if we are not following this, or without this phase unwrapping step, the tissue susceptibility, okay, the tissue susceptibility, whatever we are estimating, okay, that will be unreliable for any clinical or research use. Okay, so it will be unreliable for further research or the clinical use if you are not following this step. Next is the background field removal, the third step into the workflow. So under this background field removal, how we are getting the background field effects. So when in MRI, due to the presence of external magnetic field, we uh, we, we we get this unwanted variation in MRI phase images, right? So due to the presence of external magnetic field, we can get these unwanted variations in MR phase images. So these variations mostly we can get in air tissue interface, okay, at near to the air tissue interface, especially at sinuses or skull. Okay, at these places we can get these variations. So this can give rise to artifacts, right? So these artifacts can obscure the true local magnetic susceptibility. So due to this, whatever artifacts if we are getting, it can obscure the true magnetic susceptibility of the tissues. So to remove these background field effects, we have two methods, that is SMV filtering and sharp. So SMV filtering is nothing but it's spherical mean value filtering, okay, and one more is that is called as sophisticated harmonic artifact reduction for phase. Okay, so these two methods are very important to remove these distortions or the artifacts or the background field effects from the image, right? So otherwise it can affects the final susceptibility map into the imaging. So these are the two steps or the two methods to remove this background field noise. So by the use of this, we can remove this unwanted field effects or any unwanted field contributions which we are getting due to the external field variations or external magnetic fields. So by removing these local magnetic field effects, okay, by removing these background field effects or local susceptibility effects, what we are getting is the final QSM images. It will give us a true tissue properties, okay, true tissue properties rather than the external influences. So we are getting the true tissue properties in QSM images by after we follow this background field removal step. The next is the susceptibility inversion. Under this, in susceptibility inversion, we have to convert these local magnetic field maps into the we are converting this local magnetic field maps into the susceptibility maps. Okay, the quantitative susceptibility maps. So the local magnetic field maps are converted into the quantitative susceptibility maps. So for doing this, we require the computational algorithm because it's a post-processing step, right? So we require this algorithm, the computational algorithm, which is called as the MEDI, that is morphology-enabled dipole inversion. So by using this algorithm, it will it will increase the accuracy of the conversion from local field maps to the susceptibility maps. So in this step, we are converting it into the quantitative susceptibility map, which is a final step. So under this workflow, there are four steps. That is how you are acquiring. We have to acquire the data, the phase data. Then we have to unwrap the data. Okay, by removing the ambiguities that is caused due to the phase wrapping. Then we have background field removal, so that will eliminate the background field effects by two methods, the SMB and by using the sharp techniques. And the fourth step is the susceptibility inversion, where where this local data is converted into the susceptibility maps. So these are the major four steps. So we have to follow these four steps because, like, if okay, we have to follow these four steps. If any error, if we are getting any error among in this single step, it may overall it can affect the final image into the QSM. Okay, so we should follow these steps properly. Moving on to the advanced acquisition techniques, as I said, we are acquiring this data, the QSM data, by the use of multi-echo GRE sequences, and it improves the accuracy. How? By reducing the noise, and overall it increases the signal to noise ratio. So it acquires the multiple images at different time points. So to improve to improve this efficiency and accuracy improves the to improve this accuracy and the efficiency of the QSM, we require these advanced acquisition techniques, right? So we are having these multi-echo GRE sequences. Then we have the shorter acquisition times, that will increase the clinical usability. That means we can use this more practically for routine medical imaging, okay, by the use of shorter acquisition times. And also that is something called as better quality. So the better QSM data quality that can be acquired with the shorter scan times, and also we can acquire with the higher resolution GRE sequences. Okay, so by the use of higher resolution GRE sequences, we can acquire we could get the more detailed susceptibility maps. Okay, that will give the overall location of the abnormalities. Okay, under this advanced acquisition techniques, we have multi-echo, then shorter acquisition times to increase the clinical usability, and the higher resolution gradient sequences. So these advancement, it will help this QSM imaging to that can be more clinically accessible and can ensure the higher quality imaging, and also by minimizing it can minimize the patient discomfort, right? So we have to make this clinically accessible. Moving on to the deep learning in QSM. So this deep learning is nothing but AI, right? The integration of this deep learning and AI, okay, this significantly it improved this QSM imaging or QSM processing. So these AI-based algorithms are very important, where we have seen these four steps like phase data acquisition, but in under this deep learning, this phase unwrapping, then background data removal, and the susceptibility inversion. These steps can be done automatically by the use of AI. So thus it will by thus it will reduce the processing time, and also it will minimize these artifacts, right? So it will minimize the artifacts as well as the processing time. Then this neural networks, obviously it is a part of AI. So neural networks which are trained on, which can be trained on larger data sets and feed into the system. Okay, so these data sets or these data sets, it will increase this accuracy of the quantitative susceptibility mapping or the susceptibility mapping by feeding the complex data patterns or the complexity patterns from the MRI data. Okay, so by fitting this into the larger data sets, can be the accuracy can be increased. Okay, of the quantitative susceptibility mapping. Then, so by using this deep learning, it can by using this deep learning in QSM, it can increase the reliability and also the efficiency of the QSM, right? So reliability and also the efficiency is also increased. So that can be more useful in routine use in hospitals, and also can be used in clinical this research settings. Moving on to the standardization efforts. So one of the main challenge here the QSM which faces is that there is a wide there is lack of standardization across the different MR scanners, right? So it is not standardized across the different MR scanners and also among the imaging protocol. So there are variations in, so due to this lack of standardization, there are variations in hardware, also the acquisition parameters, the reconstruction techniques, or the other parameters. So this can lead to variability in susceptibility maps and other steps. Okay, across the multi-center studies. So, if you want to perform the multi-central studies with this technique, it may be difficult to perform this because there is a lack of standardization of this QSM technique across the different MRI scanners and the imaging protocols. So there is so to address this problem, okay, the the organization which is called as International Society for Magnetic Resonance in Medicine, they are working on to these standardized protocols, right? So standardization, if we are getting this proper, or the standardization, it may improve the reproducibility and the it can improve the reproducibility and also the comparability of the different QSM results across the centers. Then these are the applications. So first is the neurology, to visualize the iron deposition. So in neurology, we can visualize this iron accumulation in certain diseases like Parkinson's and Alzheimer's. In Parkinson's, we can detect this iron in substantia nigra area into the brain, and in Alzheimer's disease we can detect this iron accumulation in hippocampus and the cortex region. Also, we can detect this in the iron can be detected in multiple sclerosis. Next, like, next is in stroke and hemorrhage. The application in stroke and hemorrhage. So the microbleeds, it can visualize the microbleeds and calcifications properly because, like, we can distinguish between these microbleeds as well as the calcifications. Why? because these microgrids are the paramagnetic in nature, which is having a positive magnetic susceptibility, while the calcification are having a it is a diamagnetic in nature, which is having a negative susceptibility. So due to this difference, we can visualize this properly. The microgrids and the calcifications can be distinguished properly, and also we can see these hemorrhage progressions. We can monitor these hemorrhage progressions. The next is in myocardial ion overload. So in myocardial ion overload means there will be ion accumulation in cardiac areas. So into the heart, the iron we can measure with this technique. There we can measure the heart iron levels. So we can detect this in early stages, and also it can provide this we can use this like for non-invasive measurement, which can be alternative to heart biopsies, and also for to visualize the certain diseases like hemochromatosis. Then in oncology, we can use this QSM technique to visualize or to detect the tumor oxygenation, okay, to assess the tumor oxygenation and overall vascularity of the tumors. Then also we can visualize this brain tumor imaging, like the different types of tumors can also be visualized, and also this difference between like the benign tumor and malignant tumor can also be made. Coming to the challenges and future directions. So into the challenges, as I said, there is a lack of standardization across the different MRI scanners, and it also requires the complex or complicated computational algorithms, right? So because of this also there can be some artifacts which can arise. Artifacts and noise can also arise. So from if during the page unwrapping process, if it is imperfect, if it is not proper, so that time artifacts and noise can be arised, okay, and lack of standardization. So these are the challenges of the QSM. So future developments can be we can use these deep learning methods or the AI, and also instead of these normal computation algorithms, the fast computational algorithms can be used and include hardware. So these can be the future directions. Coming to the summary and conclusion, so this quantitative susceptibility mapping, first of all, it is a cutting edge MR technique or the advanced MRI technique that will provide the quantitative images, wherein in conventional MRI we are getting the qualitative images. And it is a non-invasive, it can provide the non-invasive measurement of the tissue susceptibility. So these are mainly used to assess these iron, calcium and myelin distributions within the various tissues, and it can also used in multiple medical fields. So particularly the applications include in neurology, cardiology and oncology, where it can able to diagnose and monitor some conditions like neurodegenerative diseases like stroke and myocardial ion overload and tumors. So this is my overall brief explanation about the QSM technique. Thank you.
Thank you, ma'am. If anyone has any questions, you can post it in the chat box. Ma'am will answer it for you. Are there any questions?
Is there any questions? I don't see any questions in chat box.
Well, it seems like there are no questions as of now. So we can go forward with the session. Thank you so much, ma'am, for the beautiful and in-depth explanation of magnetic susceptibility mapping in MRI and for breaking down the workflow and its applications. I'm sure it has helped all our participants to attain a deeper understanding of its concepts. Thank you so much for your time and efforts you have put into this talk. We are deeply grateful to you.
Thank you everyone for providing me with this beautiful opportunity to deliver a guest talk. And also I appreciate this chance to share my knowledge and insights with this audience and also the students. I hope everyone understood this topic. And special thanks to Muriel ma'am for giving me this opportunity.
So as we now come to the end of Acharya Red Connect 2025, we shall move on to the valedictory ceremony. I would like to take a moment to reflect on this remarkable journey that we have had together. We have spent the last 22 days diving deep into the latest advancements in medical imaging technology, with each speaker sharing their invaluable knowledge and expertise with us. We have had speakers from all over India and a few from international speakers. The enthusiasm, engagement, and the wealth of learning that we have all witnessed have been nothing short of inspiring. So it is now time to express our heartfelt gratitude to everyone who has made this possible. First and foremost, we are honored to have the continued support of Indian College of Radiological Technology. Their support has been a constant source of inspiration for all of us. And now it is my privilege to invite Professor S. Paneer Selvam, the Registrar of ICRT, to share a few words with us.
Uh, Thank you, Muril. Am I audible?
Yes, sir.
Okay, thank you, Muril. First, a very good morning to all of you. First, I would like to thank the top management of Acharya Institute of Allied Health Science and the faculties, particularly Muril, Swapnil. Hello.
Yes, sir, you're audible, sir.
And Jiva and others for doing the wonderful job of conducting the webinar, the series of webinar. It's not an easy joke to make it continuously without a break, except Saturday, Sunday, all the other days we had a webinar. First, I would like to congratulate on behalf of ICRT, which is a subsidiary of ISRT, for doing this wonderful job. On behalf of me and Mr. Shashi and others of ICRT team, we would like to congratulate each one of you for doing this wonderful dedicated job. As you are aware that ISRT, of course, ICRT is a subsidiary of ISRT, has a simple motto, always I tell, to promote education. So this aspect is well taken care of by Acharya Institute. You have promoted the education in terms of webinar. I have seen the attendance, some day 100 people, some day 60, 70, 80. It doesn't matter. That doesn't matter. Even 10 people are going to be benefited by this webinar. All the faculty of Acharya, please take it as a success. So this is one simple word I would like to say. No need that there should be a 300 people or 400 people for webinar. Even 100 people comes, even 50 people comes, at least 10 people are going to be benefited. That is a great success. So this only actually as a ISRT, as an office bearer, we always think. And you people have done a tremendous job, which definitely a success as far as me is concerned. I wish this sort of a program, we also should think in other form like we are also very happy and proud to say that in future also we are very happy to be associated with you for not only for the webinar, even the workshop or CME, or it can be in a symposium pattern, or maybe a state level conference. And of course, Shashi will highlight more on that because he is from Karnataka and your institute is from Karnataka. So you have a very good faculty who is involved in ICRT program. So you can directly talk to him and fix whatever the assistance or help you need from us. Anytime we are ready to do that. Okay. So that is the message I would like to take. And I also thank all the dear participants who have participated right from the day one to till today. You have a real interest in learning the new things. That's the reason you are logging in and you are watching the webinar. I know it is very critical and tricky time of 11 to 12 in the morning hours. It's not an easy time. All of us will be busy with their own work. But in spite of that, the really interested people have joined. And thanks to each one of the participants for making this program a grand success. And finally, once again, I'd like to thank the top management and particularly, as I said, Swapnil, Murel, and Jiva and other faculties for doing this wonderful, great job in promoting the education. Thank you, Murel. Thank you very much.
Thank you so much, sir, for your kind words. Next, I would like to invite Mr. Shashi Kumar Shetty, Coordinator of ICRT and Course Coordinator of Department of Medical Imaging Technology, KS Hegde Medical Academy, Bangalore, to say a few words.
Thank you very much, Muriel. Very good morning to each one of you. The first at most, I wanted to thank Acharya Institute of Allied Science, and especially the principal of Acharya Institute, Dr. Venkatesh Jayadatta sir, on who initiated when I met him along with the Swapnil, a good friend of me. We met in AHS Con in Bangalore, and sir said we will have something good program. And immediately after that, Swapnil came up with some program, wanted to have it. Then Mural contacted me saying that, sir, shall we have this program? As Panirsalam sir mentioned, having 22 speakers and 22 days spending, it's not an easy task. And including Swapnil, Mural, Jiva, and Manas is well managed, and it was well organized, because sometimes some speaker were not able to log in on time. So you had to give technical support also. I think Swapnil well aware of that. I used to discuss with him, and even some participant. So those every part managed and handled very well. And also, I wanted to thank each speaker. Today Amita was there. She was my student. And even earlier, even Dr. Rahul Kotian sir also is online. I can see my teacher given a wonderful talk. I was listening on the day. So I wanted to thank each one of you, and especially all the participants. As Panirsalam sir mentioned, we no need to concentrate a big number, because always some of the program when we organized, we say to the 600 participant, 1000 participant, but how many of are benefited? That's the most important. So when I always used to mention that as a small gathering, there's always good benefited and more knowledgeable sessions. So with that, so I had a wonderful session. Once again, thank to the management of Acharya Institute of Allied Science, including principal and other members. Special thanks to Mural and Swapnil. And once again, I thank to my mentor, Professor Panirsalam sir, who guided me and who, given all the guidance and support to host this event. Thank you. Thank you, each one of you.
Thank you, sir, for your thoughtful words. Shashi sir and Paneer sir has greatly helped us to ensure the smooth conduction of this event, and your inputs have made a huge role in making this series so successful. Thank you, sir. It is my pleasure now to invite a figure who has been working tirelessly to ensure that every detail of the webinar is in place for the past whole month. I now request Mr. Swapnil Shetty, Program Coordinator and Course Coordinator, Lecturer, Department of MIT at Acharya Institute of Allied Health Sciences, to say a few words.
Thank you, Muriel. So, good afternoon, everyone. So, almost 12 o'clock right now. So, it's a great pleasure for me to stand before you as the organizer of Acharya Institute of Allied Sciences for our webinar series, RAT Connect 2025. So, it's been a remarkable journey for almost 22 days and having almost 22 experts of medical imaging technology giving us their knowledge and expertise in medical imaging technology. So our goal for the event, so it was quite simple for us. So it was mainly to create a platform for all the students, technologists, even faculty members to so that they can learn, engage, and grow in our field. So obviously, when we talk about medical imaging technology, it's always a growing platform. So it's there for us. So when we are busy with our work life or even with our student life, it is very difficult for us to learn about the advancements or even refresh about our knowledge which is there in medical imaging technology. So our basic goal was to provide that platform so that we can do something better with our department. Definitely there is AI and different technologies which are there to help us out. So first and foremost that we need to know about those things is that it is all man driven, right? It's human driven. So definitely we are a part of medical imaging technology, and for the AI or any kind of tool to work, we are there and we need to be there for that, right? So for that, that is the main concept of this webinar series. So of course, first and foremost, I would like to thank a heartfelt thanks to all the speakers. So they have graciously shared their experience with us and taking their time, giving their expertise talk, right? In be it, even from diagnostic radiology, even till therapeutic radiation. We had all sorts of speakers who took their sessions, even from being, radiation protection or be it advancements, or till, something like radiation protection and its ethical considerations. So we learned a lot of things since last 22 days. And I hope that all the participants were, they'll take the knowledge back to their place, right? Definitely they'll be there. And of course, as Shashi sir and Paneerselvam sir said that, a lot of them couldn't join. Definitely it's, when we talk about day-to-day life, of course, we'll be all busy with our own, things going on or anything else. But I definitely want to thank all the participants for, giving your support to us. Definitely we started quite late when we, sent all the circulars for the program, but definitely there are a lot of, support coming from there. I would like to say that we had almost around 230 participants joining our webinar series. They had registered for the webinar. Definitely, whoever haven't joined, of course, don't get disappointed. We have all uploaded the videos for the previous webinar series. You can go and check it out in YouTube. We have already uploaded all the webinar series till last day. And I would like to say that, there is a huge support from the participants. We have almost 100 to 150, views for each and every video that we have uploaded in YouTube. So first, that's that. And other than that, the final and special thank you to, ICRT team, especially to Paneer sir and Shashi sir. The first moment that we took, when we came up with the groundwork for this event, Shashi sir and Paneer sir directly gave a green signal. They did not ask any kind of questions. They said, definitely anything for medical imaging technology, anything for learning, any kind of platform which is there for learning and, even let's say that advancing our knowledge, like increasing our knowledge, definitely they are there for us. So I would like to take my time here and thank them for their support that they have given, the type of support they have given, and I'm really grateful for that. uh, of course, other than that, I would definitely like to thank our management team from Acharya Institute of Allied Sciences, and even our principal in his absence right now. So, Principal Sir, Dr. Venkatesh Jayadat Sir, has been a backbone of our department, and he has definitely supported us for any kind of event that we do, and his enthusiasm has always been there for us. So thank you everyone for joining this webinar series. I'm definitely sure that you have made, we think that, whatever knowledge has been given to you, you'll take it back home, and, you'll be able to learn from it. Thank you, everyone.
Thank you, sir, for your motivating words. It is now time to get the feedback from any participant who has attended the webinar. It would be great if anyone could give their feedback. You can unmute yourself and introduce yourself and tell us about your experience regarding this webinar. If you are unable to unmute, you can raise your hand. We'll give you the access of speaking.
Ma'am, may I speak?
Yes, sure.
Hi, my name is Arjun Binu. I am from Acharya Institute of Allied Science of Medical Imaging Technology. And being a part of the 22-day RAD Connect webinar has been an enriching and insightful experience, to be honest. And it has been a privilege to learn many technical aspects of MRI and from the expertise of the speakers. And I sincerely thanks to all the previous speakers for the informative session, and for the today's speaker, Ms. Amit Digambar, for the insightful class on the topic quantitative susceptibility mapping. And I'm really grateful for this opportunity to be a part of this wonderful learning journey. And thank you so much for this webinar that is conducted by our Acharya Institute of Allied Health Science.
Thank you, Mr. Arjun. Is there anyone else who would like to give their feedbacks? Or even a speaker is fine. We would like to hear some feedbacks even from any speaker. I can see that some speakers have joined us. So if you would give us a feedback.
Good morning, everyone.
Good morning, sir.
Hello.
Yes,
Yeah, are
sir.
you able to hear me?
Yes, sir, we are.
Yes.
Yeah, I think I take this opportunity to congratulate the Department of Medical Imaging from the Acharya Institute of Allied Health Sciences because it was a very unique event. Firstly, traditional conferences, workshops, they last for a day, and we try to push in 20-25 topics in a day. And that at times becomes very difficult for the student to understand, grasp, and pick some key points from very good lectures. So this unique idea of spreading it over a period of 22 days, hats off, it was a good initiative, and the students had a time to pre-read, post-read, get a knack about things, understand different aspects of the topic, and get into the depth of those topics. It was a great initiative. Congratulate the top management of the institute and Swapnil and team for organizing it very well. Uh, Special thanks to Professor Paneer Selvam and Sashi Kumar Shetty, who have wholeheartedly supported their full support to organize this event and guide our students and Swapnil and team. Lastly, what I want to say is, see, at the time where I talk about myself when I started studying medical imaging way back in the year 2005, it was a total different scenario. Okay, we did not have a lot of well-established colleges, faculties, guiding us in the direction what you are right now. So it is really important that you capitalize this particular opportunity, understand which modality you are good at, okay, become sub specialized in that. And you if you see, radiology is changing totally. When I joined radiology, it is all about general radiology. All radiologists were basically reporting all kinds of reports. But if you see today, we are in the age of AI and subspecialty. We have radiologists who are even subspecialized. They are fellow certified, board certified for specialties like neuro, oncology, MSK, body imaging, and you name it. So even I would take this platform to motivate all my medical imaging students, to take a step forward, explore about such specialization available across different parts of the world and India soon. We have a very good council which is set up, and understand your modality likes, and choose what is best for you, and become an expert in one modality. I think with those few words. Thank you very much and have a very good day.
Thank you, Rahul, sir. Is there anyone else who would like to give feedback?
Yeah, one student, Gayatri, she raised a hand.
Am I audible, sir?
Yes, you are audible.
Really, I have to thank the Acharya Institute for this wonderful webinar. As rightly said, it was covering more topics, a wide variety of topics. I'm happy to be a little part and a speaker in this webinar. I also learned a lot from these lecture series, and it is very nice that you posted everything in YouTube so that we can go at any time and we can listen the classes. So thank you so much for the organizers. Thanks a lot.
Thank you, ma'am.
Thank you. Can you hear me?
Yes, sir.
Yes, sir, we can hear you.
Just give me a minute, Muriel. I want to just thank, is Professor Selvan there?
Yes, sir.
Professor Selvan and Dr. Rahul Kotian, thank you so much. And Dr. Shashi, thank you so much for, being a part of our webinar series and, guiding our students and our colleagues about the recent updates and all the recent advances in radiology. And I think, as Dr. Rahul Kotian rightly said, that today we are entering into the era of AI. And I'm so happy that my students and all the students over here in MIT have been exposed to what is happening around the world. I sincerely thank you on behalf of our management and my faculty from Acharya and also from the department of MIT for, being a part of this excellent webinar. And unfortunately, I couldn't join due to a lot of constraints and all the programs. But thank you so much. And thank you, IRCT, for being a part of Acharya and feeling that Acharya is our own. Thank you.
Thank you, sir. So that was our principal from Acharya Institute of Allied Health Sciences, Dr. Venkatesh Jayadatt. Thank you for your kind words, sir. I can see another participant has raised their hands. Mr. Naveen Thomas, you can.
Muriel, Swapnil, with your permission, I will take leave.
Yes,
I
sir.
will.
Thank you.
Thank you. Thank you. Have a nice time. Thank you so much for your excellent coordination in arranging this program. Thank you all. Thank you so much. And my dear students, thank you being a part of this excellent webinar on radiology. Professor Shashi and Dr. Parniselvan, I think we should really meet one of these days. Please make it your time to come over to Acharya and be a part of our campus, and we will arrange for some more different good webinars or FDP programs.
Sure, sir. We'll do it, sir.
the support, we can, really make this program a real success. Thank you once again. I'm sorry, I am just have to
Thank you, sir.
go
We'll
leave
do
you
it
people.
definitely.
Thank you, Professor Panneerselvan. Thank you so much for
Thank you.
helping and guiding us. Thank you.
Thank you, sir.
Thank you, sir.
Thank you, Professor.
So,
Thank you.
yeah, Mr. Naveen Thomas, you can speak now.
Good afternoon, everybody. Can you hear me, madam?
Yes, yes, I can hear you.
So myself, I'm Naveen Thomas. I'm currently working as a radiographer in Triple M Madras Medical Mission Hospital in Chennai. So I completed my BSc graduation in 2023 because I don't know about this session, those which was conducted by Acharya, because my colleague sent me this link. But when I join this link, or when I attend this class, this is a very inspiring and impressive class for me, because a lot of things I learned from this. And also I thank all the professors who had conducted this program, this webinar. Especially I remember some of the names only, especially Paneer sir and other professors, because I also, my sincere thanks to all the professors, because they had from the lot of things I learned from them. And also the Paneer sir told that what all what all we learned, it is to expose to others. So what all things that we have learned is to expose the others, or especially our colleagues or some other guys. That's our responsibility. So sincere thanks to my sincere gratitude to all, especially this Acharya Institute, for giving giving me this participation, and also how they conducted by. But some of the session I cannot attend, because due to the duty, due to the duty and night duty. So all some of the class I already attended through the videos that were uploaded in YouTube. So thank you for, especially thank you for the Acharya Institute.
Thank you, Mr. Naveen Thomas, for such a wonderful feedback. We hope that this entire webinar was greatly beneficial to you. So let us move on further with the vote of thanks. I now request Mr. Jeeva M., Lecturer, Department of Medical Imaging Technology, Acharya Institute of Allied Health Sciences, to deliver the vote of thanks.
Good morning to one and all. Am I audible?
Yes.
Yeah. Good morning to one and all here. As we conclude Acharya Rad Connect 2025, I take this moment to extend my deepest gratitude to everyone who contributed to making this webinar series a grand success. First and foremost, I sincerely thank all our esteemed speakers who shared their valuable knowledge and expertise with us. Your insights have gratefully enriched our understanding of achievements in medical imaging technology and inspired us to push the boundaries of learning and practice. A special note of appreciation to our patrons, Sri B.M. Reddy, Sri B.M. Premnath Reddy, Srimati Shalini Reddy, and Sri Krishna Basini Reddy for their continuous support and encouragement. I also extend my gratitude to our respected principal, Dr. Venkatesh Jayadath sir, and Dr. Nufur Sinha, Head of Academics and Research, for their guidance and leadership in making this event possible. We are honored to have had the support of Indian College of Radiological Technologies, ICRT, and I extend my heartfelt thanks to Professor S. Panneerselvam sir. So thank you very much, sir. ICRT Registrar, and Mr. Shashi Shetty sir, ICRT Coordinator. Thank you very much, sir, for their invaluable contributions and collaborations in making this event successful. Your association has truly added value to our initiatives. Yeah, big thank you to all participants, students, professionals, and imaging technologists who actively engaged in this series. Your enthusiasm, curiosity, and commitment to learning have made this event truly impactful. Lastly, my appreciation goes to Department of Medical Imaging Technology, Acharya Institute of Allied Health Science, Mr. Swapnil Sethi, Course Coordinator, and Mr. Muriel Gomes and Mr. Manas Kumar for the relentless efforts in their organization, the webinar series, shamelessly. While this series has come to an end. The learning, discussion, and professional connections we have made here will continue. We'll look forward to seeing you all in future academic engagement as we strive to grow and innovative in the field of medical imaging technology. Thank you all once again and wishing you continued success in your professional journey. And finally, this is Jiva, Department of Medical Imaging Technology, Acharya Institute of Allied Health Science. Once again, thank you all for being here and have a great day. Thank you.
Thank you, Jiva, sir. As we come to the conclusion of Acharya Red Connect 2025, I want to leave you with this message. Learning does not end here. This is just the beginning. The knowledge and skills you have gained over the past 22 days are the stepping stones towards a brighter future in medical imaging. Let us continue to learn, grow, and inspire one another. A small note to the participants: kindly provide your valuable feedback by clicking on the link that will be shared in the chat box. Once your feedback is submitted, the certificate shall be provided to you by email from the ID used to register for this webinar within a week's time. Thank you once again to everyone who has joined us for Acharya Rad Connect 2025, and we hope you will stay connected and continue to push the boundaries of knowledge and innovation. We look forward to seeing you at future events. With this, we officially conclude the webinar series today. We wish you all the best in the future endeavors and hope you continue to make strides in your professional journey. Thank you and have a great day. This is Muriel signing off.